In 1924, United Charities of Alexandria operated out of one room with one volunteer and no budget. Our original mission was to help relieve poverty. To do that, money was collected from churches, organizations, and money boxes placed in public settings. Can you believe it? A weekly stipend of $2 was given to an unemployed person, and a family needing food got $5 a week. Those were our beginnings. In the 1920s and 30s, minutes from our board meetings described scenes reminiscent of the Great Depression. We had people going without food, being thrown out in the streets with no medical care. We tend to think of the Depression as a black cloud on our nation's economic and social well-being, but the fact is, the very same social problems and human needs still exist today. In 1931, United Charities spent $12,128 to assist 700 families. Programs at that time included rent and utility assistance, dental care, health care, and prescription medications. The League was asked by the community to help children have a safe place to live. This was a forerunner to today's foster care and child placement services. The organization was forced to close its doors during World War II as citizens were mobilized for the war effort, but was able to reopen after a year. The 1940s brought with it a growth of direct services to those in need, with an increased focus on working with other community resources. The organization started providing a free school lunch program, free books to needy children, legal assistance, a day nursery for working parents, and a mental health hygiene clinic. In 1950, the word family service became part of our identity. The primary purpose was to provide professional casework programs. Family Service of Northern Virginia began broadening its reach into the community. It developed a partnership with schools to provide counseling and groups for students at risk. Throughout the 1960s, the demand for assistance exceeded the agency's ability to serve. There was also a new emphasis on volunteers to help the 3 full-time and 1 part-time caseworkers. In 1964, there was a merger between Alexandria Family Service and Family Service of Northern Virginia. This formed Northern Virginia Family Service. In the 1970s, many of the programs created a vastly different picture from the initial $2 or $5 that was given for food or clothing. The agency was of immense help to parents and those youth dealing with drugs. In 1975, the organization began to provide direct assistance for the Jefferson Village housing community. In 1978, the agency procured its first federal grant to help Indo-Chinese refugees. Also, it launched the Special Foster Care Program. Under the block grant program of the 1980s, the growth of the agency took off. The rapid growth of community outreach programs birthed the Family and Community Development Department. Teams of neighborhood development specialists, along with the family outreach workers, provided services in 4 different locations. In the 1990s, the Housing Services Division expanded and became a major focus. It provided housing counseling, transitional housing, homelessness prevention, and neighborhood outreach. In the 1990s, Northern Virginia Family Service also launched its Healthy Families Home Visitation Program, Early Head Start Program, and Training Futures Workforce Development Program. Health services were also dramatically expanded in 3 jurisdictions, providing critical services to children and adults. In 2001, Northern Virginia Family Service made a name for itself by managing the Pentagon Survivors Fund. With the organization's ability to couple direct assistance with long-term case management, Northern Virginia Family Service was selected by the Community Foundation out of all the nonprofits in the region to do this work.
We were always ahead of our time in creating services to meet the needs of our communities. The unique thing about Northern Virginia Family Service is its rich history in how we look at new and innovative ways to address problems in the community. We are investing in families, engaging volunteers to be part of the solution, and thereby strengthening our community.